Okay, let's say some words about Meniere's disease, which is a problem in the inner ear. Let's define it. So, Meniere's disease is a, let's say, not really understood problem. The mechanism is not quite understood. There are some theories about how it happens, but it manifests clinically as episodes, let's say episodes of some things. Vertigo, which is quite hard, tinnitus, hearing loss, and fullness in the ears. So those are the characteristic of the attacks, which is episodics. So I say attacks of Meniere's disease. And the attacks, those episodes usually last about 20 minutes to some hours. Between attacks, the person may be quite normal, but as the disease progresses, about 5 to 15 years after the disease progresses, the hearing loss, the tinnitus may be more constant and not just at the time of the episodes. The causes are not quite clear, genetics, environmental, and the pathophysiology is not quite clear also. They talk about the endolymph, which is the liquid in the inner ear. Let's say this is the cochlea, the inner ear. So there is a fluid in it, and they talk about hydrops, endolymph hydrops, which is excess endolymph, which somehow causes those attacks, those episodes of vertigo, tinnitus, hearing loss, and fullness in the ears. So it's usually in one ear, not both, but it can become in both ears. And in Meniere disease, there is no clear treatment for it. Let's call it even management and not treatment, because the treatments are quite not evidence based. They talk about low salt diet, and they talk about diuretics, maybe as a consequence of the hypothesis of the mechanism of excessive endolymph. So if you take low salt diet or diuretics, you will reduce the amount of fluids, and maybe the endolymph hydrop will become less severe. Anyway, it's not really evidence-based or too much of help. They talk also about corticosteroids, and there are some tympanostomies, but all those treatments are not really based on evidence that they are very helpful. The disease will probably progress, and the treatment is quite symptomatic. I mean, in those episodes, the vertigo may be quite hard. The nausea, as the vertigo is quite hard, can be quite hard. So we can give something for the nausea and everything. Usually it manifests at the years of 40 to 60 in this age. Again, episode usually in one year of attacks lasting 20 to some hours of tinnitus, hearing loss, fullness in the ear, and vertigo. This is the Meniere disease, and between those episodes the person may be quite normal, but as the disease progresses, the hearing loss and the tinnitus may be more and more constant. There are to diagnose this disease, there are clinical characteristics, and you can probably look it up at Wikipedia or anything anywhere else. And what I remember is that for definitive diagnosis, you need a tympanometry that will catch the hearing loss, and you will need those attacks that last some minutes to hours. That is characteristic of Meniere disease. And something very important to remember about Meniere disease, I think, is the differential diagnosis for this disease, which is transient ischemic attacks. So probably the person with Meniere disease, especially if he has risk factors for TIA and stroke, should be evaluated for this disease, for this problem. And I don't know if you think about doing CTA, MRI, or something to diagnose or differentiate Meniere from TIA or stroke. Probably TIA because it's lasting for some minutes and hours and then go away. So probably TIA would be more appropriate, as TIA is stroke clinical characteristic, but that lasts less than 24 hours. So TIA is much more appropriate. But also there is what's called a labyrinth migraine, something like that, which say that all this thing is secondary of or the characteristic of a migraine of a person. So migraine is also in the differential diagnosis, and we can think about this as well. So those episodes of 20 to some hours of hearing loss, tinnitus, vertigo, and fullness in the ear should probably be thought as Meniere slash or TIA or a migraine of the labyrinth. Let's say migraine, just migraine, and you should think about this. And that's it. That is about Meniere disease, this quite peculiar disease. If you have anything to add, please add the comments. If I had any mistakes, please correct me. Thank you for listening and watching. That was about Meniere's disease, and that's all.